Together webinar series. This morning we have a distinguished guest from Italy. We're happy to host them as our lecturer this morning, Professor Carlo Roberto Comici, and he's from the University of Padua, and he has a master's degree in political sciences and sociology and master's in nursing, and he's the coordinator of the Nursing School of FATRE, University of Padua, and also Erasmus supervisor, and he's a professor in charge of mental health nursing, actually. So we're happy to have him, and we'll hear from him how we had been running the nursing education in the era of COVID and what problems actually the School of Nursing faced throughout this phase. The floor is yours, and I would like to remind our reviewers and followers that you could just post your questions through the chat box, and at the end of the lecture, we will forward them to Professor Comici. Please, the floor is yours. Thank you.
Thank you very much for your invitation. That is very appreciated. I'm very honored to be here with you in this webinar with your university. Now I'm going to present something that is not easy to explain how nursing school has arranged the didactical issues during the pandemic. It's not very easy because we didn't follow any scientific approach, but we follow the ancestor try and errors, honestly. And we still continue to try to understand better what is right as what is wrong. I'm going to present you a PowerPoint presentation. I hope my English will be correct. So I think, okay. Well, I'm going to explain briefly the University of Padua and the Italian didactical system. Okay, this is the University of Padua, and Padua is in Italy, in the northeast of Italy, and near really 30 kilometers from Venice. I think you know better Venice than Padua, but Padua is a very, very old university. I think probably the first in Italy and the second in Europe. He has been founded in 1222 and is a very famous and multidisciplinary university. The Italian education system is the European one, okay? So we have a first level degree, the bachelor one, that we call laurea, okay? Nursing is inside the bachelor level degree is the first step of for university. Then we have a second level degree that is a master, that is the laurea magistrale. In between there is a thing that here in Italy we call, but it's not correct, master, that is a short specialization degree. For example, student nurses that obtain the bachelor degree can do this master of first level, that is a specialization degree, for example, in palliative care, in mental health, in intensive care, in management. That is a university academic specialization school, but it's not a master degree, okay? This is not correct. Then you can get into the laurea magistrale, that is the second level degree, okay? You have the master degree. There is also some master degree that is single cycle. For example, medicine don't have the bachelor and then the master degree, but is only one single 6-year master degree. there is also a second level after the master short specialization degree, and then there is the doctoral degree, PhD in programs, and specialization schools for physician mainly. This is a diagram. You can see that we have 13 years of pre-university education. Then we get 3 years of bachelor degree. Nursing had 3 years, not 4 years, for example, as you, I think. Then we have a first specialization master, okay, a specialization school after the bachelor, 1 year. Then 2 years of master degree, and then the PhD, 3 years, or the master of second level, specializing school of 1 year after, okay? Okay, no. The schools of the University of Padua are 8. We are going to talk now of the School of Medicine, okay? The School of Medicine have several courses that are medicine, surgery, dentistry, pharmacy, 20 health professions bachelor degree, 6 health profession master degree, and 36 specialization courses of first and second level, and 43 medical specialization school. Medicine is very strong in Padua, okay? Is probably the first university about medicine with publication and so on. These are the health profession bachelor degree that we can find here in Padua. You can see that nursing is one of the bachelor degrees. Okay, there is also 6, as I told you, health profession master degree, and there is also the midwifery and nursing school that give you the master degree. The master degree in Italy is only give competences on research and management. We don't have, like for example in Spain, but I don't know in Turkey, a master degree in nursing on clinical issues. For example, on mental health. They are foreseen by the law. The law has wrote that we need this kind of master degree in clinical subject. But till now, we have only the master degree in nursing school on research and management. Okay? Please stop me if something is not clear or you have some questions. It's a discussion, it's not a lesson. Okay? These are so we have nursing school of the University of Padua. These are the heraldic of the many schools of the University of Padua. For example, this is of Venice, and this is of Padua. The nursing school of Padua in Italy is a bit different from the other European country. We don't have one big school in the campus of the university. So, for example, we don't have a big school of nursing in Padua because it's the University of Padua. But the University of Padua has 8 nursing schools in the region Veneto. This is the region Veneto, okay, in Italy. And the University of Padua has 8 nursing schools in Padua, in Venice, Treviso, Portogruaro, Feltre, where I am, Montecchio, Monselice, and Rovigo. For example, the University of Verona has 2 schools in Verona and here in a place called Vicenza, and also in Trento and Bolzano. What does it mean? It means that the nursing school of the University of Padua has about 1,400 students. Okay, so it's a huge nursing school. but they are scattered in 8 nursing schools. Every nursing school has 200, 250 students, consider the first, second, and third year. Okay, this is a big difference between the other university in Europe, and this is why the students from Erasmus, from other universities, say, oh, I'm going to do the University of Padua, and probably they are assigned in Venice or in Feltre or in other parts that are not Padua, but it's the same university with the same study curricula, theory and practice. All the didactical issues and the teaching staff are set and provided by university. So a nursing student from Mestre of Venice has the same preparation, the same curricula of students of Padua or Rovigo or Treviso or Feltre. Okay, so it's the same school, but with 8 schools in Region Veneto. Okay, another difference between Italy and the other European country is that the university is really connected with the local health authorities, with the sanitary system, Italian sanitary system. What does it mean? It means that in Region Veneto, for example, there are 6 local health authorities that provide public health for all the citizens. The University of Padua and all the universities in Italy are strictly connected. What does it mean? It means that study curricula, theory and practice, all the didactical issues and the teaching staff are set and provided by university. Okay? But clinical placement and local instructors and mentors are provided by the local health authorities or provide hospital association. Okay, so there is an agreement between university and local health authorities and to provide the education for in the nursing school. Okay, let's see, for example, what's happened. I'm Venetian, so I come from Venice. I know very well the situation in Venice. This new one is the Hospital of Mestre, and this old one is the Hospital of Venice City Center. Okay. The student of the nursing course of Venice Mestre follow the lessons and attend exam in a building nearby the main hospital of Mestre. Okay, they are students of the University of Padua, so they do exams as the other students, all the other schools of university. But the clinical practice is given by the local health authorities. That is called AUS SS, that is Enterprise United Local Socio-Sanitary Services, okay? And we send the students in these hospitals, but also in some private hospitals, they give, for example, oncological and palliative care. So there is lots of agreements to provide to the student the best clinical practice that we can. So only in Padua there is the university hospital. In all the other nursing schools, there are the public hospitals. Okay, am I clear explaining this? Is it clear for you the differences, the particularity of the Italian system? Because it's not common in the rest of the university in Europe. Other examples, the academic staff of the nursing course of Venice Mestre hold since this year regular education to nurse clinical mentors about mentorship. So there is lots of education. The staff of the nursing course educate the instructor of the clinical placement. The number of educated clinical instructors is about 300, okay? While the number of official mentors is 40. The education is related to pedagogical issues and clinical and also ABP issues. So the clinical practical instructors that are nurses are educated on pedagogical issues and clinical and ABP. Okay, they also collaborate us with lessons and simulation at nursing courses. What does it mean? It means that, for example, all the practical lesson, laboratory, exercitation, simulation are provided to the students together with the clinical instructor of the clinical placement. Usually there is the academic mentor, me, for example, okay, but also the clinical instructor from the real clinical placement. This is to give to the simulation the best simulation as possible. Okay, so we try to connect the clinical and theoretical issues together with practical issues, real clinical practice in the hospital. Okay, this is common in the University of Padua. Now let's talk about the COVID troubles that affected our university. I put this, I don't remember the name of the painter, Japanese painter that showed this big aggressive wave that scattered around this boat. Okay, these boats, there are two boats. We had the big first trouble the 21st of February. We had the first case, not in Italy, but the first case in Region Veneto. Okay, the zero. Before we had two Chinese in Rome, but the first Italian, that means that the contagion was scattered in the territory, was the 21st of February. Then from the 1st of March till the 4th of May, we've been in hard lockdown. It means that everything was closed. Everything, okay? I want to show you if, let's see if it works. Okay, let's see what's happened. Okay, can you see the screen with the diagrams? Do you see the map of Italy?
No, Professor, we are not seeing it. We have a black page.
Let me see what I can do. Okay, Google Chrome, condividi. Now? Okay, perfect.
Yes.
I want to show you what's happening in Italy. If we go to the county of Venice, we can see this. Hurry up. Okay. You can see this diagram that is loading. Okay. In March, 24 February in Venice, there wasn't any COVID case. But if we go the 29th, there was 19 COVID case. In the 4th of March, 59. You can see the curve here, how it has increased, mainly in the second wave that we are going to talk about. From November, in the 31 of October, we have 8,341 cases. And let's see now how many cases we have. Okay, so this is in particular because we can see the flow of the contagion, that it wasn't the same in all Italy. For example, if we go to the worst county, you can see Bergamo that had several deaths. We can see that in the 20, how many cases? 11,000 cases the 4th of May. So the difference in Italy was really, we had some parts of Italy in the first lockdown with several cases really hard, and other parts without problem. Okay. Now let's back to the presentation. questa. No, questa. Ok. Sorry that I'm really sorry, but okay. Torniamo. Okay. Okay. I was there during the onset of the epidemic. And I remember that at the end of February last year, I had, for example, the student of the first year in the medical units. And they told me that there was 2 cases in geriatry, okay, with hard respiratory distress, and that they were thinking that it was a case of coronavirus, but nobody knows. Then the same patient went to intensive care because they get into the severe distress. In the ICU, there were 2 Erasmus students from Spain. When there was the alarm about the escape from Italy, they phoned me on Saturday morning, saying, "Professor, we are in the airport, we are back into Spain." Okay, thank you very much to advise me so early, I said. But then I phoned them on the Saturday night. I remember I made a call in Barcelona at midnight, calling them, say, the patient in ICU were positive. So please stay in quarantine, okay? Because and also the students of the first year, we have students in quarantine in Italy and students in quarantine also in Spain. And all the units of the Hospital of Venice, the medical department, and also the UCUR were closed in lockdown with all the patients and nurses inside for 15 days. With the people with the Pizza Hut bringing them pizza to make them eat, and with the person bringing them clothes and dresses because they were absolutely, but nobody knows how to manage. The first reaction was the ancestral reaction, okay, let's close everything. Nobody moves, like in the medieval age, okay, the same. We do the same. It was quite an archetypal. Okay. Other hospitals, for example, an hospital near Padua were completely closed with the students inside. In an hour, they decide to close all the hospitals. So 1,000 of people, nurses, parents, patients, and students were closed inside the hospital. I show you in the 3rd of April, we had 4,068 people in intensive care. The 29th of July, at the end of the first wave, we had only 38 patients in intensive care, okay? I think that you know this picture, this photo, that is a nurse from an intensive care in Lombardy that fell down exhausted after a shift in a COVID unit. What's happened in the academic system? All the clinical placement has been suspended from March till May. So all the clinical practice, the internship, was suspended. All the students back home from the clinical practice. Students were so involved in activities, preclinical and extraclinical preclinical laboratories. So, for example, we tried to give to students skills and competences that usually were get into the clinical real practice doing simulation in Zoom. and in didactical electronic platforms. The Minister of Health wrote to all the universities stating that clinical placement could be partially made in online mode. For example, the Italian students at the first year must achieve 480 hours of clinical practice. They must stay in the ward to get to the exam for 480 hours. Second years, 660 hours. Third year, 720 hours. And they must get all these hours if they want to continue the studies. The minister said to us, okay, but they can't, they mustn't, because there is the epidemic. And so they permit that a number of hours could be made by online mode. So in a month, all the nurse and educators, academic nurse and educator, made a big switch. From a traditional mode, we very quickly learned how to manage the informatic systems. And so all the activities traditionally made in classroom now are made on Zoom, on a Moodle. Moodle is our didactical platform. Okay, I don't know what is enough common, but some other places have other didactical platforms. Obviously, it wasn't internship. It was a surrogate of the clinical practice. Okay. This is our platform. This is Moodle face validity. Okay, so we can see all the laboratory. Tirocinio means internship, and laboratory are clinical practice. And you can see, for example, accessi venosi centrali is a central line. Okay, and these are all the activities made to for the laboratory about central line. Okay. Infusional central line, and lots of Zoom. Many hours spent in Zoom meeting at all hours of the day with all these poor students trying to have a bit of space into the small windows during Zoom, as we are doing. So lessons were only online. Exams only online. The planning of the academic year of last year was changed to permit the internship. So what we done? Lessons and exams were anticipated from the end of June, were shifted in April and May. If the students weren't allowed to go into the hospitals, okay, let's anticipate lessons and exams. Why? Because maybe in June and July, situation could be better. And so they can return in hospital. That's what we done. And so lessons and exams were anticipated from the end of June to May, early days of June. In this way, the 3 years, the third years, went in practice in June, July. Okay, the second year, the same. This was assured for the second and mainly the third year. Both made at least 5 weeks of practice instead of, on average, normally they do 14, 13 weeks. We manage 5 weeks. That it's only a drop. It's very few, but better than nothing. Okay. Students of the third year made, and students of the second year made 5 weeks of internship in real clinical practice. We sacrifice the first year. We say the first year, if we have to sacrifice an year, let's sacrifice the first year because they have another 2 years to rescue the competences and the skills that they lost into the clinical units. But we are very connected with the local health structures. And so every nursing course have different situations. Let's see. We have many differences on local base. We had a big lack of personal protective equipment. We didn't have gloves and masks, for example. And this was a big problem for students. The situation was uncertain, and we were very worried for student safety. They are students. They can be sacrificed so easily. Hospital and wards were completely changed. For example, medical units were disappeared. Pneumology became COVID hospitals, and so they were locked. Hospital, nursing homes, and wards were completely closed to students. Nursing and mentors were completely changed. We didn't have the same personnel, the same mentors, the same instructor. Nursing and mentors were scared. They were really scared. I told you one personal experience. During this lockdown in April, my mother were in cardio surgery. And so I attend my mother every day. I'm a good son, after all. But I was there and I was looking nurses, colleagues with the professional eyes, and they were absolutely scared of all the visitors. Every visitors come from outside was, I don't know, like a danger. Okay, and so if we were worried for the students, which kind of education the students with this kind of clinical settings. Hospital were dangerous places. We had in the first epidemic, the place where the people get infected was the hospitals, and this is our big worry. The health minister wrote in the first decree in March 2020, the clinical presence for students of the medicine, the health profession was possible, okay? Everything was closed, but not the clinical internship. But every university had the freedom to decide. University, in their turn, let freedom to decide to the local health authorities. So, for example, Padua continued with clinical practice. They never stopped the practice. But, for example, Venice stopped the Venice local authorities. They didn't have enough gloves, enough masks, and so they stopped because if we give the masks to the students, we don't have enough masks for the professionals. And so we say, I'm sorry for you, but we don't have enough masks, gloves, and dresses for the students. The students returned when we had enough supply for them. So in June, July. For example, Feltre in the Dolomites made only 15 days of practice for the first year. Mestre for weeks, a month. This depends from the local health authorities. Okay? A short theoretical degree. You can see this systematic review from Nurse Education Today. It's from March 21, and this means that the articles, the papers are good, okay, are not made during the pandemic. The conclusion about what we done. Among the three learning outcomes, skill-based, cognitive, and affective, virtual worlds are the most effective in improving cognitive outcomes, such as theoretical knowledge. This suggests that virtual world may be used as an alternative or complementary method to teach theoretical knowledge in nurse education. What does it mean? It means that the virtual reality simulation, all the things we made in Zoom or in Moodle, had a sense and is effective, but if we have to follow what this systematic review say, in the cognitive field, not in the affective on the skill-based. I think this is common sense, but this is a good evidence, okay? This means that all the good and hard work we made to switch the didactical units in informatic mode was absolutely effective for the cognitive part. During summer, we go to the beach, we have lots of parties, we enjoy the sun and the end of the lockdown, but the second wave arrived. And I like this painter because there is a storm, and after all, we were like this sailing ship without the engine, in only the wind is this sailing ship were without any chance to move. Okay, they are in Balia. They are in the hands of God, of the wind. Okay, maybe I'm too dramatic, but excuse me. Okay. During September and October, epidemic slowly increase, but lessons during the first semester are set in dual mode. It means that the lessons are held in presence, but at the same time online. So we have half of the students in lessons with COVID rules about the classroom, okay? And the other half of the students follow the lessons online, okay? The students can choose how to attend the lesson. All the activities, laboratory and practical seminars and exercises are held in presence with a strict respect of the anti-COVID rules. So, for example, the basic learn support, okay, BLSD, are made not in 12 students, but in 6 students to permit the correct distance, okay? Clinical practice is permitted. University of Padua also provided financial facilities and benefit, house, public transport, electronic device, and so on, okay? But the winter is coming. This means that the 4th of November, we have a new lockdown. All the contagion widespread in Italy, and this is really severe. You see how the curve in November start to increase in quite a logarithmical mode. For example, the excess of mortality, that is the difference between the normal mortality and the mortality during the COVID period, is in Piedmont, near Turin, 98%. It means quite 20 points more than usually. In Veneto, this region is 12, quite 13 points more than usually. Friuli is 25 more than usually. So we have a very high mortality rate. It means that all the hospitals are crowded of people. Region Veneto asked the University of Padua, okay, from the half of November, lesson became only online because the contagion is widespreading. Region Veneto asked the University of Padua help. Please give us hands and legs for the units, for the hospitals. The nursing school of Padua and Portogruaro and Treviso, where the situation is really, really bad, permit to the students of their third year to go to the nursing home, to the hospital, or to phone to the people to do the tracking of the tracking, also in the swab points, to help the local health authorities. They go into the nursing home or in the clinical setting also during Christmas holidays at the end of December. But, and I'm going to talk about this, normally the second year is scheduled a period of clinical practice from the 19th of November till the 22nd of December. It means that we are in the middle of the worst period of the epidemic. So we have a dilemma. I talk about the nursing academic staff of the University of Padua, okay? The second year is young. They need to go to the clinical practice, but is really young. Young, I mean that have only 15 days of practice, clinical practice, amount for practice, nothing for our experience. After all, it's not a second year, but it's a first year in the middle, okay? It's like a first year in April for us, if I have to be very empirical. So we have to decide if to send the students or not in the clinical practice. They are students, okay? We have enough gloves and PPE, personal protective equipment, okay? So there's no problem on this kind of furnitures. But hospitals are in deep trouble. Clinical settings are few, disorganized, and in emergency. The tracking system is overwhelmed, and the lots of nurses and doctors are isolated or make swab every day to strict contact with COVID positive. For example, in emergency, arrived lots of people that after they are discovered as positive, so all the personnel that touched that patient need to be checked for positivity, and they are isolated or not. Mentor and nurses are really, really busy and worried. These are the critical ideas and the points, the key points that were on reflection to send or not students in practical internship. The questions were, is it a risk that students can take? Is it ethical to expose students to these risks? Is this learning after all? This is a good dilemma, okay? And believe me, we were very, very divided as staff. There was people saying, no, okay, they are nurses, they need to work on the field. Others were more pedagogical. No, please, this is not the right setting for apprenticeship. So we decided to send the students, okay? We decided to send the students. Okay, let's go. There is a chance and nobody knows if there will be another period of normal internship. I was for this, for example, I was on this side. I say, what will happen next year? Next year, we don't know if there will be another big epidemic or not. So if we have a small, narrow way to send the student to clinical practice, let's send, because better now than nothing, because we don't know what will happen. This could be a challenge. There was also another, because some colleagues of mine say they are young students, they are little, okay? And I say, no, they are not little. This could be challenging because they are students that need to see, they are becoming nurses. And I think that for them was quite an insult, say all the people are fighting, sorry for the military metaphor, all nurses are fighting and we are not fighting. I don't know, I'm sorry, maybe because I was in the army when I was younger than now, but it's my point of view. Okay, but we have to monitor in a strict way this kind of practice. So, we send students to new clinical placement. And so we use for the second year, that is not common for Italy. In the second year, usually students go to medical or surgical wards. Stop. This year, we send students, because there were free places, because medical were COVID units, okay, to emergency, intensive care, non-COVID, pediatric and obstetrical units, and also in hospice, okay? That was uncommon, and the students didn't have, for example, the second year, preparation for the intensive care. They didn't follow the lessons. They followed the lesson only of medical, general medical, and surgical, general surgical lessons. Not intensive, not palliative, not pediatric, okay? So we anticipated the practice. So we put the practice, clinical practice, before the theoretical lessons, okay? With new mentors, we play a lot with the students about responsibility, empowerment, and self-learning. We put little emphasis on evaluation. We say to the students, don't mind about evaluation. You are there to work together with nurses to get new skills and competences. Evaluation, don't put evaluation on the center of your attention, okay? Great attention to safety and PPA. So COVID laboratory about how to dress and so on. Academic mentors always ready to help and solve problems. What does it mean? It means that all the academic mentors were on the field. They were in the hospital. Usually we don't stay all day in the hospital. We go there to a couple of days a week. But in this problem, we were always on the hospital ready to solve a problem. We use a lot of WhatsApp. We create lots of WhatsApp group with the students to solve problem. And believe me, I solve lots of problem, because when the night shift of the students were isolated because a patient in emergency or in cardiosurgery became positive, and so all the students were in tracking, they sent to me messages, say, we are under investigation by the clinical direction to understand if we can work or not. And so we were ready to solve this kind of problem and to give support to the students. Another way to monitor were the reflective journal. We gave to the students the possibility to write about the experience using a technical, an approach called the metaphor of the sailing, or the landing of the airplane. So it was the start to fly, what's happened during the fly, and then the landing, okay? It's one of the approach of this narrative method of self-expression. Okay? So, let's talk about what's happened, for example, in anticipating the clinical setting. These are some articles, for example, of a Turkish one, experience of Turkish undergraduate nursing students in the intensive care unit. But for example, nursing student experience of stress during clinical practice. Also I wrote this, okay? The conclusion were, for example, intensive care proved to be an effective learning clinical environment, but further students are needed to determine both personality characteristics, allowing students to successfully deal with complex and stressful environment. It means that if you anticipate to students of the second year the experience of complex settings, this could be done, but you need to follow well the students. You need to work on the students, okay? But after all, this kind of anticipated learning has been successful. The students didn't lose competences, didn't have bad experience on it. Okay. Reflective journal. I want to read you some what's happening to the students, and these are sentences extracted by the reflective journal given to the students. For example, the first time I entered in the world, we are talking about this kind of experience, the experience of the second year students in November during the pandemic. The first time I entered in the world, I felt my leg shaking. I was agitated, but at the same time excited to start a new adventure in a new world that until then I never experienced. Another feeling of the students before getting to that come from the diary. I had my heart beating fast with happiness, and at the same time fear, as it had the first days of school. How much tension waiting to receive the call of when I will start and where, above all. Finally, the email of the mentor arrived. Okay, you are going to cardiology. You can imagine the joy I felt and the enthusiasm I had. All right, tomorrow we start. The students need to go to practice. They wish to go to practice. This is what come from the diaries. And this is a sentence from a student that were positive. And so she didn't went to practice. I have to say that I felt a bit of envy towards the companion that next morning or afternoon would have started. I did not experience the feeling of fear, but also the joy of first day, the most awaited one. Okay, so students needed to go to the practice. But at the same time, what's happening? In any case, the first 2 days of internship were not easy. In the middle of the morning, on my first day, I was told that the nurse I was working with was positive. While on the second day of my internship, 2 patients tested positive. It was obstacle races, okay? Every day there was a trouble. Another sentence. They seemed to me, the nurses, very tired and exhausted. Shiny eyes and tired smiles that for so long time is sculpted on the face. Students found nurses very, very tired and worried. Okay. I was particularly touched when the patient relatives were introduced to get information about them, but without being able to see them. This is one of the major concerns of the professionals. Patients were alone and parents were alone. The loneliness of the patient, also in the moment of dying, were absolutely touching for the students. This is the Journal of Professional Nursing, another overview of the literature, and I'm going to finish. Some students suggest that the moral duty to help is felt more acutely by nursing than qualified staff. Various students have reported association between students' willingness to work and the level of knowledge about infection prevention and control. Another issue that needs to be investigated is the impact that the experience of working during the pandemic has on nursing students. Students examine the needs of students during the health services are likewise required to as a design and a support mechanism of them. Now, the storm is calming, okay? Students has been all vaccinated. Professional and students that refuse to be vaccinated have been removed from the clinical setting. This is a law of the state. Nobody can touch the patient without vaccination, okay? Lessons are still in dual mode. Exams are in presence. Clinical practice is regular, even if trouble occurred during February. Let's cross fingers, okay? Let's see what's happened. Thank you very much. And I'm finished. Sorry, I talked too much.
Professor Comicio, this was an exciting, overwhelming lecture. I'm very happy to hear it from you. And
okay.
So nice to remember a year ago, which is not far away, but we think that we have been through like years and since the beginning of the pandemic. And it's a good realization that it's not just ourselves in our university, but it's worldwide. And all we have been going through is actually the same. And you were just commenting about this is not a scientific approach. Yes, this is not, because this is never going to be a randomized controlled trial of HIV.
It's true.
This is an experience gained through disasters. And as Italy and in Turkey were accustomed to natural-made disasters, this is another type of disaster, which affects the way we perform our healthcare, providence to our patients. This is duty as academicians, but also people in the field, but also how it affects our education. And you have given us great examples. And I have a question waiting for you from Yazija. And she asked about, okay, you have been telling us, and we also have our students who have missed the experience during the first wave because we were not that ready. Thankfully, we didn't have that much inexperience or a situation with the PPEs. We had a shortage for a very short period of time. It wasn't a big issue, but all the things that you have mentioned has been true for our students, medical students, and for our nursing as well. But now she's curious about, will you think about an orientation program for our nurses who will be in the practice because they have graduated and they didn't have a chance to replace the missing clinical practice? Any, future thoughts about that? Because it's a great idea. COVID-19 period graduates. That's what's going to happen in the healthcare providers, including the nursing staff, physiotherapists, and physicians. And we will call them, well, you graduated through the COVID-19 era, you're one of them. So any thoughts for that?
Okay. Which is the question? Sorry.
No. Do you have any plans to have an orientation program for COVID-19 graduates? That's
for the people that already get the degree, no, absolutely no. We anticipate the degree to give new nurses to the local health authorities, honestly. And so they were like a young soldier put in the middle of the fighting, okay? I think they're going to, I don't know, I will be very curious to understand, and a student of mine is working on this, which was the experience of these young students put, because they were young, and so they were put in the worst units. And so they put, okay, let's go to the COVID units. To replace the nurses, and there is no a program. I think that every local authorities create a path, but we never stop to be in emergency, and so we didn't have the time to reflect. We have only a couple of months where to have a breath. I hope that my management start to think about as you already thought.
Okay, thank you, great. And your comment is critical. This is a quick maturation period for our young colleagues and they didn't have a time to think. They found themselves in this, you called it a fight, but yes, this was a fight. This was a fight against a virus, just, very small, tiny virus, but took over the global people, the economics, the healthcare, everything, and education as well. So we are thinking that we are maturing ourselves as well. And one final comment, I know I talked a lot, but this is also great. You touched upon that. The theoretical knowledge actually improved throughout this virtual reality or online teaching. So I guess that after this COVID era, we still have the virtual reality teaching materials or remote education as a part of our, the traditional way of teaching in terms of making sure that they get the cognitive field replaced with online education. But with the effective learning and the skill-based, we have to be in the field, in the hospital, in the clinics, be it the health ministry of hospitals, local organizations, or the university hospitals, but we still need to make sure that everyone gets on hands-on courses and training as well.
Yeah.
Any last words, Semaja? Do you want to comment? Then we'll have to wrap up.
Thank you very much for your sharing your time with us, Alberto. Your presentation is very detailed, and it is very nice to learn about in Italy. And thank you for again.
Oh, I've been I'm very grateful to you to give me this opportunity to talk with people, very important people with a good university. And it's always the time to share knowledge and experience with people all around the world and with good people like you. I'm sorry, maybe I'm too rhetoric, but excuse me, okay?
Yeah.
No, thank you very much. We appreciate your time and your knowledge, and we wish all of us best of luck with the COVID, and hope, keep our fingers crossed.
Okay. In Italy, we also do in this way, but it's a bit rude. Let's do in an international way.
Yeah. Okay. And we are also looking forward to have our students back as full students in the campuses. Starting the next year, and hoping to move forward with our vaccination programs, including the younger students as well, because we had the senior students getting vaccinated throughout these second wave, the third wave, and we'll see. Thank you very much. Hoping.
Thank you to you again.
Goodbye. I'm in Istanbul, and take care. Have a good day. Thank you very much.
Okay. Thank you. Goodbye.
Thank you for joining us for this session. See you for the next webinar. Bye.
See you next week. Goodbye.
Bye.